Hello, everyone. Our topic today is cardiovascular wellness for women. We're privileged to have with us Dr. Donna Zwas, a cardiologist and the director of the Linda Joy Pollin Cardiovascular Wellness Center for Women at the Hadassah Medical Center. Donna, welcome.
Thank you. Very glad to be here.
Good. Donna, please get us started by telling us a bit about yourself, about your background and your current position.
So I'm a cardiologist at Hadassah University Medical Center, and I am the director of the Women's Heart Center, which we started almost 15 years ago after a very generous donation from a woman from the Washington area who actually was serving on all sorts of committees about breast cancer until one day she realized that it's heart disease that's the number one cause of mortality in women, and she really created a movement in the United States, and we're very, very proud to be part of that movement here in Israel. So our goal here in Israel is to increase awareness of heart disease in women, among women, so that they can advocate for themselves and get the help that they need, to give women tools to care for themselves, and also to educate healthcare providers about heart disease in women, because if a woman has chest pain and sees her doctor and he or she decides that this doesn't need any further evaluation, then we haven't accomplished anything. So we work hard on the individual level in our clinic setting and in the community level, trying to work in different groups of women with different challenges in order to help them get the care that they need, and also, as we said, with healthcare providers.
Terrific. Is there anything uniquely Israeli about cardiovascular wellness for women or about your center?
I think what's unique about our center is our ability to go into the community. A lot of centers focus on women and women's heart health and maybe do some information with Facebook, but we, because of the unique relationship of Hadassah with women's organizations and with the community, have been able to go into community centers, into different programs in partnership with the City of Jerusalem, programs in partnership with the Ultra-Orthodox communities in Jerusalem, and with the Arab communities in Jerusalem. So I think we have a unique community impact that doesn't exist elsewhere.
Could you tell us a little bit more about the work with the Arab community in Jerusalem?
So the Arab community in Jerusalem, speaking specifically about women, they have a 60% higher mortality from heart disease than Jewish women, and they get sick 10 years earlier. And this is really a staggering statistic that requires intervention. In fact, the mortality of Jewish men is lower than Arab women. And you have to think about throughout the world, the mortality of men is so much higher here. Jewish men do better than Arab women. So as soon as we started our program, we looked around and said, this is a community with significant needs. And there's a huge problem of obesity and diabetes. Over 50% of the women over 45 are obese, not just overweight, but obese, and they have a 50% lifetime risk of diabetes, which is more than twice that of what we see in the Jewish population. So we immediately got our tools together and we took the Center for Disease Control Diabetes Prevention Program and we translated it and we culturally adapted it and we implemented it, and it did not work at all. And we were like shocked and until we realized that these women, in terms of knowledge, were similar to women anywhere who are listening to to social media or have the communications available to them. But we're missing some basic tools in terms of self-efficacy, real cultural challenges in terms of taking care of themselves and putting themselves in the center. So we created what we call our Resilient Diabetes Prevention Program. We give them tools of self-efficacy, how to take care of themselves. And suddenly, as opposed to just learning, they're actually able to take what they learn and implement it. And with our Resilience DPP, we see tremendous changes, weight loss, increases in exercise, and we also see transformative changes in their lives, from their family, from different roles within their families, to getting degrees, to starting businesses in their basements, to starting, group leadership, community programs. So this has really been one of the really rewarding programs that we've done. And we continue to do it, and the City of Jerusalem continues to support us, as do some private foundations.
That's terrific. That sounds so important, and it sounds even quite effective. Can you now tell us a bit about your work with the Ultra-Orthodox, the Haredi community?
So working with the Ultra-Orthodox community is extremely challenging because you have to get access. And our first program took us almost 3 years of cultivation until we were able to be kosher enough and get the approval. And you have to recall that every single community is its own community, and you have to start from scratch with their own community. So we did several programs with teachers in the different Beth Jacob schools, which are really the leading schools. So the idea being that by working with opinion leaders, we can actually create change, and we were able to do programming for them for nutrition, physical activity, stress reduction, and also how to incorporate that into their teaching. And we did a large community-wide program with a Hasidic group, which I'm not going to actually give the name, but it's a large Hasidic group in Jerusalem where we were able to get to really thousands of women, thousands of girls in schools with our interventions, and we've really seen cultural changes. It's very hard to ask Mrs. Cohen to make a change in what she does in her family unless people around her are doing it. And so by working on the community level, we're able to make changes, get people away from the kugels and into the healthy vegetable salads and legumes. And really just small shifts can make tremendous differences over time.
Well, that's really interesting. Do you have any parting thoughts you want to give to our audience?
Well, it's important to me, first of all, that women realize that they are at risk of heart disease, and that heart disease in women may manifest differently than it does in men. Men may develop classic chest pain. Women may have all sorts of different discomfort in the upper body. We always say that if a man has chest pain, everybody looks around for their phone, how to call for help. If a woman has chest pain, she says, maybe I did too much, I'll take some aspirin, Tylenol, I'll take care of myself in the morning. So it's important to me that if there's some little whisper in your consciousness that says this is something different than something I've experienced before, please listen to that little voice. Get help, get assessed. It's not a terrible thing to go to the emergency room and get an EKG and get tested. It's much better to go to the emergency room several times and not to miss the real cardiac event. The other message that I want to give is people with chest pain, they go to the emergency room, they do an EKG, they tell them that everything's okay. That's not enough. In addition to just getting that one-time event, you have to continue. You have to make sure that there isn't something wrong. You need to ask for a stress test, ask for a further evaluation, and really work on those risk factors.
Terrific. Donna, thank you so much.